Hi everybody, it's Angela Ardolino with It's a Dog's Life, and I'm thrilled to be with Dr. Trina Hazzah, who is a cannabis leading expert when it comes to our pets. She's an oncologist. She's been working with this incredible natural medicine that we know all about for a very long time now. And I am so excited to be here. I met you and first saw you and heard about you at the HVMA.
Yeah.
And I always tell everybody this. I come from the cannabis. I'm in the pet industry. I'm in the rescue industry, if you could even call that. But I came from the cannabis world, and I kept going to pet industry events and hearing them talk about THC killing animals. It's dangerous. Stick with an isolate or a broad spectrum product. And of course, I went to school for this. You know better. My head would, oh no, this is the wrong information. And then I went to HVMA and heard you and Dr. Richter, and I was like, ha, finally. I actually stood up and gave a standing ovation for Dr. Richter because I literally went in there scared that the wrong information was going to be given out again, because as we know, there are vets out there who have actually even put out products that, you know, a broad spectrum product, as we know, may help with some anxiety and fear, but it's not going to help with disease or seizures and the big things that are life-threatening to our pets. So to me, it's kind of a disservice for a person to go in, trust us, they've listened to us, go buy a product that has very little actual cannabis medicine in it, and they don't see a result and they're unhappy.
And they think no cannabis would work.
Doesn't work.
Right.
Or that they're so scared of the THC. So, and of course, one of the things I get most asked most often is that, well, if this is so great, why isn't my vet telling me about it? Or why is my vet telling me it's going to kill my dog? So that's why we're on this tour, not only to educate pet parents to take responsibility for their own pet's health, but to also talk to vets who have been using it, who are advocates, and you are one of the best. And thank you so much for being one of those people.
Thank you.
And thank you so much for letting us come into this beautiful hospital and interview you. I know you're extremely busy. So I want to know a little bit about you. I want everyone to know a little bit about you. Kind of your journey. When did you know that I want to be a vet, or I'm great with animals?
Yeah.
And then tell me what you did from there, what you went to school, and then how did you discover this cannabis route that you went,
Well, how many hours do we have?
As long as you want.
Right. So I actually grew up in Washington, D.C. Very few people grow up in the city, right? So I grew up in Washington, D.C. I'm first generation American. Both my parents are from Cairo, Egypt.
Oh, neat.
And interestingly, they were really into animals, right? I say interestingly because we grew up as a Muslim family, and back in Egypt, the family really was not supportive of animals, right? In Egypt, in Cairo, there's dogs and cats running around the city, and they would say, don't touch them, they're dirty. Right? And so, but my grandmother, my mother's mother, loved animals. And she, a devout Muslim, loved animals. She didn't listen to what anyone would say. She would bring the animals into her home. She would take care of them. And she loved tortoises. It's like the best. So I'd go to her house. She'd have tortoises in her house.
Yay!
And I mean, but she didn't understand salmonella or any of this. They would be sitting on the kitchen table, right? And she would name them Cairo, Alexandria, Mahdi, like all these different cities within Egypt, right? And it was amazing because I grew up having these little tortoises, and then she would, because I would go there in the summertime and spend time, and then she would say, why don't you take them back to the States with you? And I'm like, I don't know if I can. She said, just put them in your pocket. So, and I have an identical twin sister.
Oh, no way.
Yeah, we look very similar. We always joke. She says, I'm the smarter one, and we go through this a lot, right? But she is actually the largest lion conservationist in the world right now. She lives in Kenya. So we both got into animals. And part of this is my grandmother, right? Like, she's like, take them back with you. I'm like, what are you gonna, so we had these, we were very, very young, I don't know, 10 years old or something. We had these sweatshirts that had the pockets in the front, and we each put 2 tortoises in our sweatshirts, and we brought them back. We flew into Frankfurt, then we flew into the States, and with these turtles or tortoises. We fed them on the plane, like the little peas they'd give you, and then we put them back in. I mean, and so we brought these. I mean, can you even imagine?
No.
Like, yeah, now 9/11, that would
Right.
never happen. I think I had little,
Right.
bombs in me. So, anyway, so. That's kind of how it started. I was like, oh my God, this is so much fun. My grandmother loves animals. I get to run around Egypt with her and play with animals and feed them. And my mother, her daughter, my mother, and she was very into animals as well. So she lives in Egypt now, and she's always sending me pictures. Do you think I can take this one off the street and keep it? And, I mean, is this a nice breed for me? I'm like, Ma, it's like an Egyptian mutt. Just take the dog, right? Like it's, and so that, and then coming to being in the States, living and growing up here, my parents were very supportive of having animals, and we didn't have a ton, right? We had some. We had a cat and we had a dog that ran away, and then eventually came back, and then ran away again, and never came back. And then I begged. I wanted my own dog, and at 15, I finally got a yellow Labrador. It's all I wanted. After watching Old Yeller, I wanted a yellow Labrador, so I got to pick this yellow Labrador, and he was my best friend. I mean, he was my best friend until I was 31, and he passed away. So I had him for almost 16 years, and we did everything together. So I thought my father, very kind of strict Arab father, said, "You're going to be an orthopedic surgeon." I said, "Okay, well, and I was good at math and science, but I didn't realize I was actually going to be a doctor and then an orthopedic surgeon." And so I figured, I kind of go down the track, right? I'll go to college, and and then I was like, I have to pay for this dog. At 15, 16, I had to pay for this dog, and how was I going to do it? I started to have a dog walking company, my own, and then I started to work for a vet clinic, and I cleaned cages, and I was really good at cleaning the cages.
Oh, how awesome for you to go, okay, I need to make money. Let me go do it go do something I love.
Well, also I needed to pay for the dog, and the vet would give
great.
the dog free services, and she would do dentals, and she'd give me free food. So it was just the best. Like how did I get, and so cleaned our cages, and then finally one day she was like, hey, my tech called out. Can you come help me? And I was like, no, I just clean cages. Like I don't. She was like, Trina, just come help me with this. And then that day on, I was like her sidekick. I did her dentals, did her, helped in surgery, and loved every bit of it. And she was a Tuskegee graduate, and she introduced me to some other Tuskegee graduates, and she said, listen, you should go to Tuskegee. And I'm like, I am not moving to Alabama. I'm in Washington, D.C. And so I applied to a bunch of different vet schools, and Tuskegee accepted me right away, and I was on the whole list of some of these other institutions that were really expensive. They're like $60,000, $45,000. I mean, and Tuskegee was like $18,000. I mean, it was just, and I said, okay, listen, I have all this support from Tuskegee grads. They have supported me through this entire way. Let me do this. So my dog, Otis, and I moved down to Alabama.
Wow.
We were there for 4 years, and that was just, it's a life-changing experience to be in Alabama. And so, at first I was terrified because I couldn't even understand the accents, right? I was just like, are they speaking a different language? But they are just such warm, loving, kind people. And I lived in the town of Tuskegee where there was absolutely nothing. But it was so nice because even the mail lady would come in, and I'd be getting dressed out for a banquet, and I'd be like, can you come in and just tell me if these shoes look right? And she would, oh, Trina, here, I got your glasses. I'm at the CVS. Here, I found your glasses. This is the type of town, right? It was so lovely coming from such a big city. So anyway, then decided to do an internship, and there was, in my mind, I had to go to the biggest and the best. So at that time, it was Red Bank in New Jersey, which was the largest veterinary hospital in the country at that time. So I went there, and it was nice to come back to the Northeast, and Otis came with me, and then I did a residency up in Connecticut, and so he came up there with me, and it was the right path for me, and I didn't know what I was going to specialize in. I really didn't. I just knew I didn't want to do a GP work, and partly because you had to be really, really smart to be a GP, and I didn't think I was that smart. I mean, it was just to know everything. I could just know one thing very well.
Right.
And so people say, God, you must be really smart to be an oncologist. I'm like, no, you gotta be really smart to be a GP, because I don't know anything about ears or skin or, and they have to know it all. They have to know cancer. They have to know. So for me, it was like I could focus at one thing, and I ended up spending time in Tennessee over the summer, and I elected to do some oncology work there, and the oncologists there were like, Trina, why don't you be an oncologist? Like, this is what you're really good at. And I was like, am I? They're like, you should just do this. So they wrote me recommendations, and I ended up going on the way to be an oncologist. And And then Otis passed away right the last year of my residency, but he was with me through that entire process. I mean, like, that's like a homie, right? Like, that can go through it all with me. Lived in Baltimore in the hood with me, lived in Tuskegee in the hood. I mean, really just that he protected me, right? Like, he was my angel. And then I got to think I just had this beautiful gift of getting this oncology residency and becoming an oncologist, and I enjoyed I mean, I really did. I loved oncology, and I still love it. It just started to get really hard to watch these patients get sick and not being able to do very much about it. The typical medications, the Zofrans, the Serenia, the anti-nausea, I mean, it's starting to get a little old, right? Like, and I could get only but so much grasp on the cancer, right? This feeling of, as I mentioned earlier, like God, right? I could just cure it all. It didn't exist. It was like a facade. It wasn't real, and I needed to do more. And I'm in LA, so I moved to LA right after my residency. I figured I would go the furthest away from snow, and so literally, my boss asked me, "Where are you going to go? Do you want to stay here?" And I sat there in Connecticut while it was snowing.
No.
And I said, I can't stay. He said, why? I said, I'm just too cold. I cannot do it. Like, I have Egyptian blood. I cannot do it. I need to go to warm. And so, yeah, you get it, right? Colombian, right?
Yeah, we're born and raised in Miami, so
you get it.
Yeah.
Like, I need sun, I need warmth. And so he said, well, where are you going to go? And at that moment, I said, I'm going to California. I'd never thought about it. And so then I said, shoot, I gotta go look for a job in California. So I did my search and figured, well, if you're gonna go anywhere, I might as well come to LA and have the LA life. And I mean, this has been amazing. And I came to the largest hospital, right, west of the Mississippi. And it's always like big, right? Let's just see, because I wanted to have this platform to do whatever I could do, right? And I needed that support. And fortunately, this hospital has been a wonderful place and has been very, very supportive of my going into some integrative medicine. So being into practice for a while, I realized I got to change it up. And in LA, people were asking me questions. Well, I want to start this herb. And I was like, I don't know anything about herbs. Or what about food? And I was like, I don't know, just go upstairs. There's some prescription diets and there's bags and I don't know anything about it. And I was giving my own animals this stuff, right? I mean, I was a Western doctor through and through. And I didn't have any Eastern training because in vet school at the time, there was certainly none of that, right?
So when you're in vet school, how much training did you get in diet and nutrition?
Only by the large companies that produce bags of prescription diets. That's all I would say. I'm not going to mention any names in particular, but you know who they are.
Also, were you taught about the endocannabinoid system?
Of course not.
So I want the audiences to realize that most vets know nothing about diet and nutrition because they weren't taught, and they don't know anything about the endocannabinoid system because they weren't taught. So when you go to your vet and you bring this up and they don't know what you're talking about, or they're scared because they read something, understand it. Understand their innocence and where they're coming from. And even better, give them this video.
Yeah.
Introduce them to vets who have been using the medicine and who understand it. Because if a vet knows about diet and nutrition and the endocannabinoid system, that means they went out on their own and learned it. Or they know about Chinese herbs or acupuncture or chiropractic. All of this is a choice they make to learn about everything that could possibly help your pet. And those are the vets we love.
Yeah,
and she's one of them.
Open vets, right? That are saying, hey, I don't know what's going to help, but if it's not going to hurt, why don't we try a combination of some of the stuff that has been shown? And if you really look through the research, there's a lot of research out there. And I think what happens is that we were taught in Western medicine, there's nothing out there research-wise and holistic, but that's not true. If you go through PubMed, some of these Chinese herbs have tons and tons and tons of published articles showing that it can have anti-cancer effect. And a lot of them are preclinical studies or in vitro studies, but
they also been using them for thousands and thousands of years for these things.
Right? Over 4,000
just like
years.
Cannabis, 4,000 years, exactly.
No,
okay, so you got into Chinese herbs.
So then I asked this hospital, I said, hey, would you support me going to get a certification in Chinese herbal medicine? Clients are asking, I want to support that need. and they were very kind and said,
that's
let's
awesome.
we'll support you doing it. And they've supported me having, as you guys saw, the slew of herbs and material for owners to read about herbal therapies. And then I started to get a little bit into some Western herbs and medicinal mushrooms, but I certainly I didn't go in to get certification. And you start to get us more interested, right? Because you start to learn I learned all about the Chinese herbal kind of philosophy and got my certification. And then I was like, but there's more, right? There's more. And when learning about Chinese herbal medicine, you learned about cannabis. And that particular plant, I looked at it and I said, oh my God, there's over 700 compounds. This is unlike any other plant I've ever read about. I need to investigate this. And then the studies.
That's what I thought. How does everybody not simply start reading and going, wait a minute?
There might be something.
I didn't know. Something. But if lavender does this, and this plant does all of of course it's possible. A plant already has proven that it can do all of these things. Yeah, I was the same way. I'm like, I don't understand. When I saw a seizure stop immediately, I'm like, it's inhumane to keep this medicine from anybody.
Agreed, especially when dosed properly, when the products are clean, all of these things. I think that's the big thing, is that number one is don't judge your vet for not knowing that because they don't know. They don't know, as you mentioned. Like that, I wanted to add.
And like you said, you're a specialist, and what she said before, and we've learned, vets have to learn about everything. So then bringing on diet, nutrition, cannabis, Chinese herbs, all these other things, it's a lot of responsibility, especially when you're just trying to keep up with everything that's coming in. With all the problems.
So I guess I would tell a pet parent to not judge your vet, be open-minded, be compassionate, because they are doing a lot and they are trying to keep up. And I think it's our job, people that have really gotten into it and really have a passion for cannabis, to teach them. And the vets that are open to learning, we are open to teaching.
Right.
And if your vet is really just so, unable, doesn't have the time or the interest, it's okay. They're really good at maybe whatever else they're doing, and we are here for you. I think that's the big thing, is that every vet in the country doesn't have to be on board, but if you are on board for your pet, we're here to help give information and make sure that you are picking the correct product, that you are picking safe products, that you have an idea of what safe even means in cannabis world, and that you feel that you have support, because doing this all by yourself and going to the local dispensary can be a really scary situation, a scary place to go. And there are a lot of people out here that care and want to help. And I mean, I got into this because I love animals, as I mentioned. I think that medicine itself is unbelievably interesting, and I love the thought process through a lot of just working through the cases and the strategy behind it and all of that. But at the end of the day, it's your pet, right? It's your pet that we care about, and that we want the best, right? And I think that there's so many options out there. That's the truth. There's options for everything. There's options for Western. There's options for Eastern. No one knows what is the perfect combination for your pet. At the end of the day, you're going to figure that out, but we're here to inform, right? I think as veterinarians, we're here to say, here are all the options. Yep. Let's talk about what's safe, what's not safe, and then at the end of the day, you figure out what's best for your kid.
Absolutely.
We can't do that. It's the same with my kid or your kid. I mean, our two-legged kids, right? We get all the information we can. It's no different than a two-legged and a four-legged. They're our kids, you guys, right? And I think that you're just going to get as much information as you can, and then at the end of the day, you're going to sit there and make a decision just like we do for our own self. But I think just knowing that there's support, because I just get so afraid when I see these clients come in and they are like, I just went to the local dispensary, they just gave me this stuff, and I was like, oh my God, don't use it. I'm so terrified, don't use it. Your dog or cat's in heart failure and you're about to use a THC strong product, and I'm going to put them in heart failure if you start this. So please don't do that. And it's really a shame that the veterinary medical boards cannot support that. Because, and I wish owners would come out and be like, hey, veterinary medical boards, we need these vets.
They don't even know that they have to do that.
And starting and I think
they don't even know.
Yes.
And that's why we're doing what we're doing. They don't even know that it's an issue, that they are petrified that they're going to lose their license if they talk about it. because the fear has been so pushed upon everybody that this is an
Yes.
illegal, illicit drug.
Yes, yes.
And not the healing oil and product that it is. So you've been using the medicine in your practice here at the hospital. What are some of the biggest successes you've seen? Like I still get amazed. You know, when people will send me pictures from our own products, and I'm like, 2 weeks that fell off?
Yes.
Or my latest, you know, because of course I'm getting better at using the medicine and using it from the inside and outside and watching tumors explode and ooze and disappear, come detached from the spine. I've seen it all, and I'm still amazed. And I'm also amazed that people, you know, freak out when they see a tumor dying in front of their, you know, because it's a disgusting looking thing. But what are some of the wonderful things, or I would love to know one of your first times that you tried it and you were like, yes, I was right. You know?
I'm thinking probably all the way, God, years and years ago, there was a little dog named Hammer. He was a Jack Russell. And the owners came in and the dog had 3 cancers all at the same time. Which is really, really unfortunate. Hammer had bad luck, right? Like came in, low-grade lymphoma, what we call an indolent lymphoma, bladder cancer, TCC, which is transitional cell carcinoma, and then an oral squamous cell carcinoma that was fairly large. So gave them all the options, and they said, you know what, he's like our family. We're going to do what we can, but we want to make sure that we're really focused on his quality, which I think is most important.
It is most important, their quality of life, not the quality of your life, the quality of their life, that they're not feeling any pain, they're comfortable, they don't know what's happening, they don't know they have cancer.
You want to keep them feeling like that, right? And so we ended up removing this down to what we call down to microscopic. So there wasn't any obvious cancer cells there at that point, but there was some microscopic disease. The bladder cancer we removed down to microscopic as well. And then the lymphoma kind of just hung because it wasn't really aggressive. Out of all of the other 2 were worse. This owner decided to start a targeted therapy. So no chemo, just a therapy to target the mutation that was causing these tumors to go. Presumption. I mean, we don't know for sure it was going to work like that, but that's the way the drug is supposed to. So, but for those particular tumors, we don't have a ton of evidence to support it would work 100% or 80%, but we knew that there was some evidence it could work on those other tumor types. Not as much with lymphoma, and the other 2 seemed to be a higher, and those were the more aggressive ones. So we did that for about 6 months, and it worked. Like, we kept everything at bay, and around the 6-month mark, 5-6 month mark, this started to get so large that it took up his entire face.
Wow.
So it grew from all the way up here, and it took over his eye, so he wasn't able to open his eye. He could only open the other eye, the contralateral eye. And bladder cancer was starting to get worse. Lymphoma was still static, which was wonderful. And he just started to feel dumpy. He just didn't feel very good. So the owners went over our options again. And one of the things we discussed was cannabis. The owners, at that time, we weren't really able to have that conversation, but as an integrative oncologist, I felt very strongly that if an owner wanted to talk about it, I was going to guide them through the process to make sure it was safe. Because at that time, there weren't very many products that existed. So owners were very interested, and I said, okay, let's just start a 1-to-1. This is what they were doing in human medicine for cancer. I didn't know very much. I'd done some reading, of course, and was very interested in it, but I didn't know. I mean, to this day, we still don't know exactly what ratios or whatever it may be for cancer, but let's do a 1-to-1. Well, this dog was maybe 15 pounds or 18 pounds, less than 20 pounds. He started 1 milligram of THC and 1 milligram of CBD. That's it.
Every day?
Twice a day. Once in the morning, once at night. Along with that targeted therapy, the owner felt that we hadn't completely failed the targeted therapy, wanted to keep going. And I said, okay, listen, maybe there's synergy. I have no idea, or additive effect. But we have no idea. Even to this day, we still don't know. So let's give it a shot. So supported them and talked with them through it. About 2-3 weeks later, the owner said, hey, I think his eye's starting to open a little bit more. I said, no way, really, And even with herbs, I went through the same process, guys. Like, learned all about it, so gung-ho, but still a little hesitant, right? Until I started to see it work, right? And so with cannabis, it was a very similar thing. So eyes getting smaller. Okay, just keep watching. And I didn't know at that time what titration was about. I didn't know to increase the dose. I was like, look, it's working, just keep it.
Right.
So I didn't want the dog to be high, or
Right.
I didn't know.
It's your
as
first
much.
time
Yeah,
treatment.
exactly. It's a baby. So there's a baby doctor. And so I watched this process, and probably about a month in, he comes in, couldn't find the tumor.
This one, the one on the face.
Couldn't find the tumor. Like, it was taking up his entire face. Not only could he open up his eye, I opened up his mouth, and I saw maybe some redness in the back of his mouth. He didn't say the dog swallowed. I mean, usually it's like they call and they're like, it's bleeding everywhere. I have no idea. I mean, the owners, phenomenal owners, tumor was not there. It just like, I mean, he must have swallowed part of the tumor, but so Hammer was just, I always would say hammer time, and he'd run around, like, and he was happy, and he was doing them, and this is 1 milligram. So this goes back to my whole theory of it's not the amount,
right.
It's the compound that particular cancer needed.
Mm-hmm.
And that started my passion really into figuring out which cancers respond to which compounds, and can I genetically evaluate these tumors to figure out what mutations they have, or alterations, overexpressions, even looking at are these particular genes hyperactive, right? Are they silenced? So we can get a little bit more information of how do we properly target the cancer with cannabis. I think targeted therapy is phenomenal. It's personalized medicine. I think it's where the future really needs to go, and is actually going.
Mm-hmm.
But why can't cannabis be personalized? It should be. It should be for every patient, in my opinion, for everything, for anxiety, so that has been my goal for the last 5 years or so, is really trying to figure out how do we get this down. And it's gotten a little bit more intense just in the last probably few years, or a year really, where there's now companies out there looking at genetic profiling for tumors, because now I just need to figure out how do I match the compound. Because if I know that, say, ID1 is overexpressed in this particular cancer, then I'm going to use a CBD dominant product and hit it hard. Now, how hard, I don't know, right?
Mm-hmm.
Can I use 1 milligram and it might work? I'm thinking I could probably use a few milligrams if it's the right compound and get it to work. Part of it has to do with their own endocannabinoid system, as we discussed. If it's so dysregulated and unbalanced, I might need more just to balance their system a little bit, and then I can pull back. And there's this idea of potential reverse tolerance with CBD, meaning that I could start a little higher and I could actually go back. Where with THC, right, the opposite usually occurs, where you still have to keep going up, right?
Mm-hmm.
And so if I have a tumor that really needs a lot of CBD, maybe I don't even need to expose the dog to THC at all. So these clients that are so worried, or vets that are worried about THC, hey, I have something that is personalized for this particular patient and for the particular patient's tumor.
Right.
So it's looking at genetics on a level of the patient, which it certainly exists in human medicine now.
Oh, yeah.
There's companies out there that are looking at your own genetic endocannabinoid system, right? And so I certainly believe we have figured out the canine genome, the entire canine genome. Why could we not do the same and run test swabs, DNA swabs, 23andMe?
Mm-hmm.
23, and they do these what are the genetic tests in dog? Like, your dog is
Yes.
a poodle, and I'm like, my dog's like a Doberman. What are you
Right,
talking
right,
about,
right.
Like, they do these, right? It looks like a Doberman, but you're telling me it's an 80% poodle. I'm so
Mm-hmm.
confused, right? Those same tests should be able, in my opinion, should be able to be done for the endocannabinoid system. So now I know your dog's tumor genetics. I know your dog's endocannabinoid system genetics, and now I can put it together and say you have a mutation in P450, which means you're not gonna, metabolize
that.
this
Mm-hmm.
as well, this particular compound, because this is exclusively metabolized by the liver. So I'm gonna have to increase or decrease the dose accordingly. So not only I know what your tumor might need. I'm not saying definitively. I wish I could say definitively. One day I'm gonna say definitively, hopefully. But then I also know what your body needs. And together, we then create personalized cannabinoid therapy for dogs and cats. Perhaps we do this before they even do it for people.
Right.
Which would be amazing.
Right.
I mean, I think they
So
should do it
what
for people too, right?
What
Like,
you're actually saying is to use cannabis as medicine. Exactly.
Exactly.
On this dog, the Hammer,
Yeah.
did you make diet changes? Were there any other changes that You stayed on everything.
I don't think so, because I wasn't even doing herbal medicine. Well, I was starting to do herbal medicine at that time. And when I say I was starting to do herbal medicine, when I started to do herbal medicine, I started to do nutritional medicine. I started to do kind of a whole holistic medicine, right? You can't really just do one. I mean, you end up doing the whole thing. So I'm not sure if I was even doing it. The dog was probably eating, I don't even know.
Right.
I cannot remember. There's a lot. I can tell you 90% of my patients now are on whole food diets.
Right.
But at that time, I don't know. Maybe he was. I don't know. But I can say it works.
That's what's so amazing about it is that even without the other tools, you were able to get rid of this tumor. I mean, I find, I have so much fun now. I'm like, I want to see how fast I can get rid of this tumor. The first time I got rid of, the first dog that I saved was given up on, it's going to die any day, tumors everywhere, cancer, and all I started doing was 50 milligrams a day of full spectrum. And we saved the dog, and we went back to the vet, and they were like, what did you do? So
that's incredible.
Now I told you I do topically and internally is almost like a race to see how fast I can get a tumor to fall off. And I watch them from going, I can see them growing every day. You take pictures of them growing every day to it stops, it starts shrinking. Some papillomas, it actually looks like someone took a lighter or a flame to them. They start turning black and dying right in front of your eyes until they're completely gone, and then you can't even tell it's there anymore.
Have you ever evaluated if you just gave it topically?
I did. I have.
What do you think it could ever just work topically, or you really think?
Of course.
Okay.
I got rid of ones just topically, but when I did I told you it's a race.
Yeah.
When that first person who wrote me, who got rid of a tumor in 2 weeks.
Yeah.
She did internal and topically. So I went from just doing either topically or internal to doing both, and that's when I would have the most success.
Yeah.
Because they're getting it in both ways.
Do you think that malignant tumors certainly need both, where the benign could just take one, or not necessarily?
Yeah, I think it, absolutely that. Of course, if it's malignant, I want to go the whole punch and get from everywhere, including diet, probiotics, gut, get it all so that we can know that we can get it. I don't know what that means. How much time we've gone so far?
Trina has to leave at noon.
Oh, that's why. Nobody told me that part. Okay, so
can I ask you a question?
Absolutely.
Do you dose off a milligram per kilogram, or you just say, little dog, big dog, everyone's gonna get this amount?
I do it ailment and age.
I think it's smart.
If it's a geriatric dog with lots of problems, I go in strong and then pull back because I'm trying to stop seizures. I'm also, a lot of times I come off of too many prescription drugs. So I feel like I have to support, is pain gonna come back? Is anxiety gonna come back? What's gonna happen? So I also try to support it that way. But I do go big and go small because I know I've already been taught it's completely safe, and I know how it works and how it's absorbed, but I also know that every dog's different and every deficiency is different. But some of the things we're seeing now that I've had my product out for 2 years now, thanks to the Farm Bill, is I see people who not only did we get rid of the tumors or whatever the disease was, they'll start taking it for tumors, and then we realize that, the owner goes, I'm not getting up in the middle of the night to let my dog go pee. Could it be helping her Cushing's? Or, he used to drink constantly and he's not doing that, or now he's not biting his paws, or the rash on. So I feel like the more that they're taking, the more they get in their body, that it's filling those deficiencies, and it starts taking care of all of the problems. And then when we start supporting the gut,
it's like
you have a new dog. I mean, I have dogs. I love seeing the old, my most recent one, Daisy, she looked like a dead dog. And she does not look like a dead dog anymore. She runs with the pack. She barks. She can't hear anything. Actually, I think some of her hearing is coming back because she can hear someone bark outside. I know I have rheumatoid arthritis. That's how I found the medicine. That's what I take to treat myself. I get inflammation in my jawbone, which blocks off my hearing. So maybe that dog wasn't even deaf. She just had inflammation in her bones or ear or whatever, and now can hear again. So it's just, I've seen everything now.
Yes. That's
in
amazing.
the past 4 or 5 years, and I'm sure you have.
Oh yeah.
There's nothing scarier than cancer.
No,
And
it's true.
you know, people are scared of THC, and THC is the cancer killer. It will kill that tumor. I mean, it's been proven in human medicine, and now it doesn't even take as much because, as we know, pets and dogs especially have so many more receptors than we do, so they're much more sensitive to the medicine.
So
And if the
it's
medicine is
properly.
pure
Yeah.
and it's made correctly and it's bioavailable, a little bit will go a long way.
Yes,
So
you
I'm
can
glad
go with
that
your
you
product
said that.
even, right?
Right.
Yeah, yeah.
So it's I think that is the most wonderful thing. So I love how you say how you want to see the future go, and that it really is, that it's targeted, that it's used more as a medicine. How do you think other vets can use it outside of oncology? Have you seen any of that? Stress, anxiety, fear, arthritis,
Absolutely.
seizures?
All of it.
You've seen it all work on all of it.
No, I have. I mean, a lot of times it's because owners are just picking it up and doing it themselves, and then they go into their vet and say, "Oh, I went off the medicine you gave me. Well, how is so and so still doing well? Oh, I started this." And so I think that veterinarians that aren't maybe yet knowledgeable about it are starting to see there might be something. And as they start to get more comfortable and it starts to become very clear how to guide clients, because I think that it's easy to say, I just don't know, so I don't want to talk about it. But eventually they're going to be so bombarded by clients, and that's where as I was mentioning, Gary, myself, you, like, we're all here to really educate so veterinarians feel much more comfortable to say, hold on a second, let me hold your hand through this process because I learned a little bit about it, or what do we learn from each other?
Right, and we
Because
don't have to
that's-
fear it.
we
We
don't
did
have
the
to-
scary part,
Yeah.
and it's fine. No one's gonna
Yeah.
die. No one's ever died
Yeah.
from it.
No, and I mean, if it's a safe product and it's dosed properly,
You're
it
gonna be good.
really is fine. Like, what's the worst? I always say to people, because I do a lot of my patients are on a high THC product, and so I say, what's the worst happen? They look at the wall for an hour or so. I mean, really, right? What's the worst that my chemo can do? A lot worse, right? And so, and it doesn't mean I don't believe in the
or
chemo.
even some of the prescription meds
Of
are much
course.
worse. When people start getting worried about liver enzymes being elevated because of
Right.
it, well, are you looking at what the
Other
opioid is
right.
doing to them?
And
Yeah.
some of these other, and you know, and I think that there's a place for everything. Perhaps we can use, and what I'm doing a lot in my practice is using cannabis to help balance some of those side effects with some of those Western medications like chemotherapy or targeted therapies or whatever they may be, where you're getting the GI side effects, you're getting the lethargy, you're getting some of these things where cannabis can certainly balance them and say, hey, wait, I'm going to cut a little bit of your nausea with that CBDA or CBD, or, you know, this pet has really severe lymphoma of their gut in IBD. What if I can help with some of that? We know in Crohn's patients in human medicine that THC and CBD can be helpful, and certainly some of these other cannabinoids at low levels can be very helpful. So again, it always goes back to the same, which is figuring out custom for that patient. Like, your dog has IBD and cancer. How do we create a product? And maybe it's not going to be one. Maybe it's going to be a combination of a hemp product with a marijuana product, because I can't, you know, maybe I can't get enough CBD in this marijuana product. I need a hemp product to put them together, or I find a marijuana product that has a lot of CBD. But being able to figure out,
we get an internal CBD product and an external THC product. Who knows? It'll be awesome to be able to use all of those.
I've tried external THC products. They don't work that well for me. I think if you look at least in human medicine, what we know is a THC
as a patch or salve or what
salve.
it is.
Yeah. Okay. Okay. No,
Literally,
because,
we're going to Las Vegas. There's the biggest dispensary there, and that's where I can find it. And I load up on it. I get 6 bottles of it, and we swear by it at my house for us.
Really?
Yeah, my boyfriend got his whole knee redone. He put it on there. He feels no. I mean, it's the
what's
greatest.
the product?
I don't even know the name.
Okay.
It's terrible packaging, everything, but it's
But
the
it's
most
great.
wonderful.
Yeah.
I'll send you
And
one.
it's CBD.
No, it's CBD. It's a 1-to-1.
Yeah. See, there you go. So I know.
The same thing where you know it's manufactured and the bioavailability is there because it works a million times better than
I
others.
feel like it's just.
And I've tried patches that worked really well too.
Really? Because it's so rare to find patches that work.
I'll send you Colorado. Colorado is where you find this stuff. I want to be able to tell our listeners how to follow you, how to find out more about you that are more interested in what you've done. Where should they go and find more out about you?
I have a website. It's Dr. Trina Hazzah, vetnary.com. And you can find me there. I'm also at VCA West LA. If you have a pet that has cancer and want to talk about integrative health, including cannabinoid therapy, you can always come to me here if you're in the Los Angeles area. Otherwise,
if they're not, are they able to?
It's illegal to do telemedicine.
Okay,
And they just got something from the board the other day. This was like maybe a few months ago.
So that'll be our next fight.
Yeah, no, I mean it's unfortunate because I'd love to be able to pick up the phone and talk to people on the phone and say, let me guide you in this way, even if you're in Florida or if you're in, and so that. But what I would do is go to the AHVMA. They have a really good holistic site there that you can then plug in where you live, and they have a bunch of holistic vets.
And also,
pop up, which is really nice.
I always suggest that, but I also like to suggest that all holistic vets are not created equal. So even when you do find 2 or 3, and then go visit them and talk to them. I always say, if you walk in the office and you see toxic, bad products, or they're being pushed, diets are being pushed on you that are kibble, then that's probably not your choice. But go visit a couple and make a choice and see who's best. It depends on how big the hospital is.
Maybe those products are supporting the hospital financially,
True.
Right? But then
just like you're supporting the vet schools financially.
Exactly. But it doesn't mean that the vet that's at that hospital isn't open-minded. So I agree with you. It's like you
didn't choose that food. The hospital chose
exactly.
the food. Got it.
So I think that's just an important thing to say is go meet the person, go meet the veterinarian, see if you guys get along. If you're on the same page, there's people that come in here and want to do really hardcore stuff, and I say, look, I'm not the best. I'm not the best. You want to go bone marrow transplants and do I'm not your girl. You want to do. I'm open to really a combination of Eastern and Western, but the really hardcore stuff, there's got to be someone out there that can really hold your hand through that process. And so really finding someone that's on the same page as you is super duper important.